When we think of NASA, most people will think of rockets going to the moon. But at the same time that NASA has been looking outwards towards the universe, they've also been looking inwards towards Earth from out of space. With 16 satellites in low Earth orbit, NASA has been helping to fight deadly diseases like malaria on the ground.
Well, there are several ways that climate change, both naturally occurring and anthropogenically man-made cause, climate change may affect health. For example, with infectious diseases. We may see the vectors for infectious disease change.
The vectors being the way that an infection is passed on.
Exactly, like a mosquito, for example, when you're talking about malaria or Rift Valley fever or dengue fever even. Malaria kills, estimates vary, but about 1 to 3 million people across the globe every year. The Defense Department of the United States actually came to NASA because they had done an evacuation operation in Liberia, and over a third of the U.S. military personnel came down with malaria. You may see the habitats of these mosquitoes change in a globally warmed world. Now, they might not change exactly by latitude because there are some socioeconomic limiting factors to malaria that even in the developed world may keep it from reappearing. The main factor being windows and air conditioning that keep the mosquitoes from being able to fly into your home at night, bite you, fly to the next person's home, bite them, and spread the disease. So we're probably not going to look at a large increase in malaria latitudinally in the world. But what's very important is an increase in malaria in altitude. The tropical regions of the world are very mountainous in many areas in South America and Africa. And lots of people currently live at elevations in those mountains that are above the current malaria zone. But according to many global climate models, as those high elevation mountainous areas warm up, the mosquito vectors will move up the mountainside, and then you're going to have newly affected populations that have not previously been exposed to malaria who may be at risk. So we were actually able to come up with a quantitative prediction of the number of malaria cases to be expected in each province in Thailand. But then we added to that environmental data from space, from our Earth science satellites. That included land surface temperature, vegetation density, how green is the vegetation, also amounts of precipitation. And we were able to do this with about a 75% accuracy.
We hear about climate change and pollution all the time. What have you actually seen changed, say, in the last decade?
Well, in the last decade, I would say that some of the biggest issues, at least in North America, for air quality have been the advection across the Pacific of what's known as the Asian brown cloud. It is dust and pollution that is coming from China and being advected by the jet stream across the Pacific. And we can actually detect the increases in particulate matter, those very fine pieces of aerosols that can get deep into your lungs, and dust across the west coast of the United States when that Asian brown cloud comes across the west coast of the United States. We also have certainly in the past several years had a large increase in wildfires. So wildfires and monitoring wildfires from space and the smoke that they produce has been a big issue. So MODIS every day scans the globe and actually can pick out the hot spots of where wildfires are worldwide. But MODIS can actually also detect the loading of aerosols in a column of the atmosphere. It gives us a lot of information about how much aerosols are contained in the atmosphere, and then using predictive models, meteorological models, where those aerosols will be moving in the future. This is a great benefit, of course, to air quality policymakers and forecasters.
So have you found anything that might explain the increase in asthma?
Well, we certainly have theorized that with global climate change, there might be an increase in certain parts of the world in aeroallergens. And with the increase in urban heat island effects in the major cities, that certainly contributes to stagnant air, increases in ozone and particulate matter in those metropolitan areas.
What is stagnant air? How does it affect people's health?
Well, when you have, as let's say, for example, in a large city during the summertime, when you get this urban heat island effect, which the urban heat island effect is caused because cities are made of asphalt and concrete and very little tree cover. So as the sun's radiation beats down on that city, all of those buildings, streets, absorb all that infrared energy and are very slow to re-emit it at night. So if you look especially at night, it's pronounced. If you look at nighttime temperatures, for example, let's say in downtown Atlanta, Georgia, versus out in the countryside 30 miles away, you can see a pretty dramatic 10-degree temperature difference. Not only is that in itself a health concern, because actually every year in the United States more people die from heat-related deaths than any other meteorological phenomena. So we have seen that, unfortunately, in many places worldwide, the tens of thousands of deaths that occurred in Europe in the early part of the last decade during a major heat wave in France. In the United States in 1995, several hundred deaths in Chicago. So that in and of itself is a large public health impact. But when you have these types of conditions set up, you get basically a very stable meteorological situation over the city, where the air, it's not moving, it becomes very stagnated, and this traps the pollution at the low levels across the city. And we're talking about, again, particulate matter. We're also talking about pollen, other types of pollution, and ozone, which all of these cause respiratory distress, particularly among those that already are susceptible, who may already have asthma or some type of other chronic pulmonary disease.
So is NASA's information available to anyone?
NASA's data from our 16 satellites is freely available to the world.